my name is Cassandra Pena, and the disorder that I was assigned was hoarding disorder. This presentation was made for the psychology class 420 for Professor Yvonne Cook. Let's get started. So what is hoarding disorder? Hoarding disorder is when someone has a difficulty or a hard time letting go of certain items in the possession. Examples would be animals, books, newspapers, garbage, things that for some reason they have an attachment to and they can't throw away. This affects about 2 to 5% of the population, and there is a difference between hoarding and collecting. Hoarding, they're really disorganized. They don't like showing people their house because it becomes cluttered after a while, and after it becoming very severe. Collectors like to present their items. They have it organized. They could sell it if they want. Hoarders don't like to sell it or give it away at all. So there's a big difference between hoarding and collecting. So what are the reasons why people hoard? There could be numerous. There could be the item reminds them of something from the past, and so they feel if they throw it away that memory will be lost. It could be replacing something that they feel like they're missing in their life. Also, just the stress. What if someone passed away? So they just start collecting. That stress becomes overwhelming, and so they just collect, and it just becomes very out of hand. So there's numerous reasons as to why someone might hoard. There's not just one major one. Now, the types of hoarding, there are silogomania, bibliomania, animal hoarding, food hoarder, and recycler, and etc. There's all types of different types of hoarding. So the first one, silogomania, is a type of hoarding full of trash, just waste, has no value to anyone, not to the hoarder or anybody in the house. So they just collect it. That's what that one is. Bibliomania is just hoarding, collecting books, magazines, anything of literature, basically. Animal hoarding is, of course, hoarding animals to the point where the house isn't big enough to have so many animals. There's feces everywhere, just an overrun of animals within the household. Food hoarder, people could keep food for years past the expiration date, and in a way they're saving it to not waste it, but it ends up becoming waste because it's expired. And recycler is another hoarding, so saving the environment. They go out saving cardboard, paper, plastic. It's good for the environment, but they end up saving it in their homes, and it becomes severe to the point where it becomes a danger to the hoarder themselves. Now, there's different levels of clutter. The first level is a minor one. So the house is still livable. There's still access, not too much clutter going on. Rodents, anything that's not visible, it's under control. You have full access to the rooms. Level 2 is cautious, where the plumbing's not working, or you have some mold showing, some expired products, not too bad. Level 3 is where it's kind of getting unhealthy. Stuff that's normally inside a house is going outside the house. There's light insect infestation, where you can kind of see it. There's items in the shower, places that you're putting items that you shouldn't be in. Level 4 is a high. There's water damage, broken mirrors, main exit to your home is blocked. There's really not that much room in the door space or in the hallways. Level 5 is the serious one. This one is where the home is not livable. the water damage is very severe. There's insects on the bed to the point where you can't sleep on it. There's rats or mice everywhere. Spider's nest. This is to the point where people have to intervene with the hoarder, and either the house can become condemned, just because it's not livable anymore. So the symptoms and behaviors of hoarding is the major one is the inability to throw away any of the items that they have. They have severe anxiety. The thought of throwing away an item gets them not riled up, but it freaks them out, just because like that's something that means something to them, and so you may not see it, but they see it somehow. They have a difficulty of organizing items. They're very indecisive. They get distressed very easily, and they're very paranoid and suspicious. If they think that you might take something or try to throw away something, they really get paranoid about that. They have obsessive thoughts of getting more stuff, buying more stuff, looking for more stuff to put into their home. And then this functional impairment is where it starts getting within the whole family. So it's not just affecting the hoarder, but it's affecting the family from the hoarders, causing isolation between the families, causing separation between marriages, kids and mothers, parents. So this one is a really common one to see, because hoarders have a sense to isolate themselves because they are embarrassed of their situation and their environment, that they don't like to bring people into that. I have a video here, and it's just to show you a little bit of how they think, how hoarders think, and how they just live within themselves, living in this house. So let's see.
My mother used to put...
Hold on. I don't know why it's not showing.
Poop.
Okay, so the video won't show, but it's basically, it's about a lady who moved into her mother's house. She lives in her mother's house now, and her mother's passed away, and she was a hoarder. So you come in and you see the bathroom she doesn't want to use it. The daughter doesn't want to use it, to the point where she thinks that the septic tank is full. So she goes bathroom into a bucket, and then she goes and she'll cup out the stuff in the bucket, the feces, and put it into a bowl, dump it outside her home, or her mom used to save the feces in bottles or jugs of water. So she has a whole bunch of those within the house, and then she has some out in the back. So she was really, she was a true severe hoarder. The daughter is to the point where she's like that too. They came in and they were trying to, get her out of that. And so she did make a comment where she said, okay, well, let me just have one more night or one more day in there, and let me just eat one more contaminated food. She would go and she would, like I said, clean the bucket out with a cup, and she would go and eat with feces on her hands, so she wouldn't wash her hands. So she was eating contaminated food, which can obviously make you sick. Hopefully the link works for you guys, but it's a really good video. I hope you guys enjoy it. So we'll move on. So diagnosis. So this is assessment. It could go on a one-on-one interview. So they just ask different questions, and I listed some questions that they asked. Is like, do you have trouble discarding any items of your possession? To what extent do you are you saving things? Is it just anything that you find, or is the stuff that you're saving affecting your daily life functioning, or because of the number of items you have, does it affect your living space? Just simple questions like that, just to see how severe the hoarding is, and just to see how much and how long they've been hoarding for. Professionals might ask to speak with the family and friends also, because of course there's some clients that will not open up and not tell you the truth. So finding out from other collateral contacts would be very helpful to see the real situation going on. And so for the code for the that's for the hoarding disorder, for the DSM-5 and ICD-10 is the F42 300.3. Causes and risk factors. There's no really main cause of hoarding. There's different things that can play out, like stress and losing somebody, but there's really no main cause of it. There's definitely risk factors within it. Let me see. So such as family history, to the point of let's say if a child was growing up in a household where the mother was hoarding different items, and they grow up and they start hoarding, that's family history. They grew up around that, or they have a family member that has a history of hoarding. So family history is a big one. Also, genes is a big one as well. They've done some research as to possibly finding that it could be passed through genes of hoarding, of the hoarding disorder. Brain injuries, not being able to, getting the brain injuries can also affect the fact that you start saving things and trying to remember certain memories that you've had before. Stressful lifestyle, overly working, someone passing away. Everyone has different stress triggers. Age is one. It usually starts at a young age, early teens. It tends to get worse within age. Younger children may start saving items such as like broken toys, pencil nubs, or just school papers. Social isolation. You're totally isolating yourself from the public, from your family, friends, work. So it's really, this is where where they get depression from. Being by yourself, isolating yourself, this is where they kind of get a connection with the items that they've hoarded, which makes it even harder for them to get rid of. Consequences of hoarding is poor hygiene. They're not taking care of themselves. The living area is hazardous to them. Health code violations, extremely due to like bed bugs, head lice, rodents, feces on the ground, feces everywhere. Inability to do daily tasks, just to wash dishes. There's probably not going to be any dishes there that are usable or even clean, or you're able to find them. Fire hazards, if you have clutter blocking different doors or windows, and there's a fire, how are you going to get out? There's different things that can happen when you hoard, and like I said, there's different levels, and it's just depending on how severe you are, or how severe the person is on the hoarding scale. Levels. There are treatments for this. There's two main treatments that were mentioned in the research. Cognitive behavioral therapy, which is the talking, finding out, working with them, working slowly with them, and even after the treatment, they can still work with the plan that they have and still meet up with the therapist. So there's really no time period. This with this they can really help the client get to the point where they can start throwing away things little by little, not just forcibly doing it. This one is the main treatment that they go to. Another one is medication. One of the main medications that is antidepressant, and it's selective serotonin reuptake inhibitors, so SSRIs. And what this does is they're most commonly prescribed to antidepressants. They ease symptoms to severe depression. So what they do is by increasing the levels of serotonin in the brain. Serotonin is one of the chemical messengers that carry signals between brain cells. So SSRIs block the reuptake, or serotonin in the brain, making more serotonin available. SSRIs are also called selective because they seem primarily affect serotonin, not other neurotransmitters, which is good. There is side effects with this medication though: drowsiness, nausea, dry mouth, insomnia, nervousness, dizziness. So like other medication, there is side effects. So the other disorders that are associated with this is obsessive compulsive personality disorder, obsessive compulsive disorder, attention deficient hyperactivity disorder, or in depression. And these are just my references that I got my research from. And that's the end of my show. Thank you for watching, and I hope you enjoyed the show. Thank you.